viewers. Today I'm going to talk about breast cancer, which happens to be the commonest cancer in female and the leading cause of cancer death. It accounts for 0.5 to 1% of male breast cancer. Its incidence and death rate has increased over the last 3 decades due to change in risk factor profile. Breast cancer is a disease in which the cancer cell develops in the tissue of the breast. The cancer cell can further spread to other parts of the body, the lung, the brain, the liver, and even the bone. Breast cancer risk factor is divided into modifiable and non-modifiable risk factors. 60 to 70% of patients with breast cancer have no known risk factors, while 30 to 40% of patients with breast cancer have no risk factors. The non-modifiable risk factors include female. Being a female, we are at risk of developing breast cancer. Breast cancer risks increase with age. Most of the patients diagnosed at the hospital are 50 years and above. A woman that has radiotherapy to the chest wall is at risk of likely to develop breast cancer. A woman that has a personal history of breast cancer has a likely risk of developing breast cancer for the second time. Starting your period before the age of 12 years. Starting your menopause after the age of 55 years. Family history of breast and ovarian cancer in a first degree relatives. Having a dense breast tissue. First degree relatives, the father, sister, brother, son with BRCA1 and BRCA2 gene mutation. The modifiable risk factors include alcohol consumption, cigarette smoking, hormone replacement therapy, having your first child after the age of 30 years, not breastfeeding, lack of physical exercise, and also overweight. Women should look out for lump in the breast and the axilla, nipple retraction, nipple discharge, which could be clear or bloody discharge, change in the shape of the breast, change in the color of the breast, change in the size of the breast or swelling of the breast, change in the nipple retraction, rashes or dimpling are all symptoms of breast cancer. One of the screening modalities for breast cancer is monthly breast self-examination. The best time to do the examination is 3 to 5 days after your menses. It's done every month, same time. However, for women that has gone through their menopause, it's advisable for them to pick a particular day in a month to do their breast examination, same day every month. To examine your breast, you stand in front of your mirror with your both hands raised up or your both hand on your hip. Look out for sign of nipple retraction, change in the color, shape, and size of the breast, or rashes. You can also examine your breast in your seated position, lying down or standing. You use the pad of your 3 middle finger to examine your breast up, down, and circular. Other screening modalities for breast include the breast mammogram. The breast mammogram is done for women that are 40 years and above. Breast ultrasound is done for women that are 40 years and below. Another screening modality that is very important and very expensive is the breast MRI. The breast MRI is done for women that have a conflicting mammogram report or women that have a very high risk of developing breast cancer. The diagnosis of breast cancer is confirmed by biopsy. A sample of the tissue is taken from the breast lump and sent to pathology for histology. Once the histology report is confirmed, a further test is done which is called immunohistochemistry to know the molecular subtype. The molecular subtype is the one that gives us a guide on what type of treatment the patient is going to undergo. There are other staging investigations. The CT chest to rule out metastasis to the lungs and also help to know the size of the lump in the breast and the axilla. Abdominopelvic MRI to rule out metastasis to the liver and also to the other abdominal organs. The treatment modalities for breast cancer include breast conservative surgery, radical mastectomy, radiotherapy, chemotherapy, immunotherapy, and also hormonal treatments. When you notice a lump in your breast, please don't panic. 80% of lumps in the breast are not cancerous. If you notice a lump in your breast, please see your doctor for further evaluation and diagnosis. I urge all women to reduce their risks by quitting smoking, quitting alcohol consumption, doing a regular checkup for their breasts, and also physical exercise.